Good morning, everyone, and welcome to the Health Committee meeting for the County of Renfrew for Wednesday, May 17th. It is the appointed hour. I'm calling this morning's meeting to order. As we gather this morning, I wish to acknowledge, on behalf of committee and our community, that we are meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have been careful stewards of this land for millennia. Ms. Hill, could you advise if the roll has been called?
Yes, Mr. Chair, roll has been taken.
Thank you so much. I would invite now disclosure of pecuniary interest and, if any, the general nature thereof, please. I see none. Thank you. I would now seek a motion to adopt the minutes of the meeting held on April 12th, 2023. Moved by Councillor Weir, seconded by Councillor Yon. Any errors or omissions? Seeing none, all in favor? That is carried. Thank you. With that, we're very pleased to have this morning a delegation with us, and I would invite Chief Nolan, if you could please introduce this morning's guest.
Thank you, Mr. Chair, and it's my honor to introduce to you Andreas Bauer, Andy, as he prefers to be called when he's in Canada, because we're a little less formal. Comes to us from Germany, and he brought a team of paramedics, the director of the Red Cross Foundation for Bavaria in Germany, as well as a preceptor and a student who was the top student in the program in Germany and won the opportunity to come to Canada and do ride-alongs with our paramedics. And the reason that that's important is because the Bavarian Red Cross has modeled their community paramedic program after the County of Renfrew's community paramedic program. And we've had a number of sharing opportunities back and forth. So Andy, while it's not his first time to the county, it will certainly be his first time to the microphone. And I'm very proud to have Andy here, both as a friend and a paramedic colleague, to come up to the front now, if you could, Andy, to share a little bit about Ringsburg and just to share about the paramedic program that he is responsible for across the state of Bavaria. So, Andy, welcome. And you just let Tina know at the back when you want her to change slides.
Okay.
All right?
Do my best.
Good luck.
So, thank you, Chief Mike Nolan, Health Committee Warden. It's a pleasure for me to be here today and speak in front of you. So, as a part of my German DNA, I try to prepare my best if I can. If Mike Nolan asked me, would like to be interested to have a talk in front of the committee, I said, yes, I'm happy. It was a little bit spontaneous for me just 2 days ago, but now here I am. Next slide, please.
That's how we roll.
Yeah. So, at first I would like to introduce myself. My name is Andy Bauer. I'm advanced care paramedic for the Red Cross Service of Ringsburg. I'm a preceptor, advanced care paramedic, and also the chief of the advanced care paramedic education in my service. And on top, I'm the chief for the community paramedic program, which we started 1 year ago. So there in this picture you can see myself and the beautiful skyline of Ringsburg, and of course my little dog Mia. I'm going to talk today about the friendship between the County of Renfrew Paramedic Service and the Red Cross Ringsburg. But first of all, I want to give a little insight of where I come from and show you some beautiful pictures of Ringsburg. So this is Ringsburg. The city is almost 2,000 years old. It's one of the oldest cities in Germany, and we have a really historical downtown. The stone bridge, where you can see here in the back, is around about 870 years old, and it's the oldest bridge in whole Germany. Next slide, please. So by night it's more beautiful. This picture is from the Christmas time. My Marine service do a Christmas swimming to say thank you to the city of Regensburg that they support the volunteered Marine service a lot. And so, not myself, it's too cold for me. I was on the side and make some pictures, but the most of my volunteer medics jump into the 2 degrees cold Donau and swim to the stone bridge. Next slide, please. Next slide. Thank you. So, to give you an overview, this is the Federal Republic of Germany. It's divided in 16 different states and around about 82 million people live there. Bavaria, where I come from, it's here, is the biggest one, and there live around about 12 million people. So if we compare it to Canada, Bavaria is a little bit smaller and maybe a little bit more people live there, but from the geographical aspect, we have the same rural areas with same long distances. So that's the reason why we hear and learn from the County of Renfrew Paramedic Service how to run a community paramedic program. Next slide, please. So this was our first meeting. It was in 2015 in Turkey. There I met Chief Mike Nolan and a bunch of other paramedics from Canada, and I think we had a really good time there. After a couple of days, we start talking about our vision to develop a paramedic service. And so with Google Translator and all my courage, I asked Mike Nolan for an internship here because my English was at the beginning more than I'm Andy, I'm hungry, and have a nice day, that's it. But Google Translator helped me a lot. So 2016, I spent my first 3 weeks here to observe the work of the community paramedics in County of Renfrew. And I learned a lot of many impressive things from this innovative paramedic service and how it can be possible to be a leader to run a healthcare system. Next slide, please. So over the years, I would like to say we switched from a business relationship to a friendship. We visit each other a couple times, so I spent some ships with J.D. Heaven on the road. I show him the German paramedic service, as also I spent a couple times here in County of Renfrew to see how community paramedicine and community paramedics work. Next slide, please. To run a community paramedic system in Bavaria, you need to convince your chiefs. So we call him S1 and S2, so both are Sebastians. And I put him in an airplane and said, hey, you have to come with me to Renfrew to see more about the program and have a discussion with Chief Mike Nolan and his leadership team. So we spent, I think, 2 weeks here, and they saw everything and the benefits of the community paramedic program. And it was very important for me to convince my 2 bosses that they support me to go to the Bavarian government and have a presentation with my new idea. Next slide, please. So JD support us in the Bavarian ministry. We have a couple of presentations there and try to convince all the politicians. And it was a really, really big thing that the County of Renfrew paramedic service support us there. Because if you run a system and you have the feeling about a system, it's much easier to explain it. Like for me, you know it from a couple of visits. On the right picture, you see how it developed to a friendship. This little person, his name is Sepp Zenger. He was my CEO in the past. He's now retired, and he invited JD to come on his retirement party. And on the left side, you can see my new CEO. His name is Björn. And he learned everything from Sepp, and Sepp told him, hey, you have to support Andy to run a community paramedic system. So that's what he do now. Next slide, please. Every region has his own needs. So our program that we run since 1 year is a little bit different to the community paramedic program in Renfrew. But what we learned is to do it step by step and do little things really good. And that's the first year about what we do. So we are under control from the dispatch center. And our first contact, if we be on scene, is the family doctor. And we try, like here, to support the patients at home, to keep them at home as long as possible, as healthy as possible. And next slide, please. You can see after 1 year, if there was a paramedic from the community paramedic project, 74% of each patient who called 911 need no intervention at the hospital and stay at home, or we send them to the family doctor. And I think that's a huge success for the first year. And again, we are just at the beginning of the program, so I think we can develop it and have more really good success with this program. Next slide. So we learned a lot from the County of Renfrew paramedic service. So now the question is, what learned the County of Renfrew from us? And in Germany, we have really high educated volunteer special units. So that's what we show to Chief Mike Nolan. A couple years ago, he invited THW, who is the first address for disaster management in Germany. And I think they show you how to manage flooding season. So they teach the paramedics here and share their knowledge. Next slide, please. We also show Mike Nolan our different special groups. So is there a disaster? We have many good educated units. Like, it sounds funny, but it's a catering unit. They will come out and cook for all the medics on scene. We also have a special communication group. You see it in the middle of the picture, this Sprinter. It's a full equipped dispatch center. So they can come on scene and observe all the work there and be the first contact. Next slide, please. Yeah, that's our catering unit. They have a lot of fun, and trust me, they cook very good. So, next slide. We have a little bit of different structure of paramedic service. We use transfer ambulances, the 911 trucks, how you know it here. And we also have specialized intensive care units for all critical patients. So we have 3 different types of vehicles in our service. And with my education, you just at the 911 truck or at the intensive care unit. The transfer ambulance it's just 2 primary care paramedics on it, and they do normally no emergency calls. It's just for transfer between hospital, bring a patient at home, take him to the hospital. Next slide, please. So, as a result of our friendship, last year S1 was here with his family, and he signed an agreement with Chief Mike Nolan and the County of Renfrew Paramedic Service to start an exchange program. We all think it's necessary to send students paramedic to Canada, that they learn from your service, from the County of Renfrew Paramedic Service, what it means to run an innovative system. So Felix, just can see his backside, but it's Felix. He was the best student paramedic in the class last year, and he comes with his preceptor, and also Johannes Gottschalk. He's the CEO of the Red Cross Foundation, who found this exchange, was here to learn more about community paramedicine. Next slide, please. So we saw all different kinds of services who the County of Renfrew Paramedic Service run, like the drone team, We saw the Sierra team. They spent a lot of time with the community paramedics on the road. And again, it was not a business relationship, it's a friendship. So all my medics said they feel really welcomed and they really surprised about how kind all the medics been to there. And I think they developed a lot of new friendships here in the county of Renfrew. Next, please. So if it's important to you, we will find a way. If not, we'll find an excuse. It was important for me and Mike Nolan to create a friendship, to pushing forward our relationship. So we found a way to bring a community paramedic program to Bavaria, and we found a way to run our first exchange program. And again, it was really, really important for us to have this good friendship to the county. And next slide, please. You will see it here. It was Felix back home. He pushed a sticker from the County of Renfrew Paramedic Service in his vehicle to show everybody he's proud that he was a part of this project. And thank you for your attention, and I hope I can come back anytime.
Thank you very much, Andy. Most appreciative. I think that your English has, you have a skill and a capacity for languages because it is advanced. I think that I am hungry is probably quintessential for any foreigner to learn very early on, hungry and thirsty. I think that what we're seeing also is that the paramedic services probably generally, but more specifically the community paramedics, and I'm gathering that similar to Renfrew County, there's a remoteness and a spread population within the area that you're servicing. And I think that it kind of transcends language as well in meeting the needs of the population that are as dispersed I'm gathering in your area as they are here. So certainly we have, that's been our experience with the community paramedicine. It's getting so far out in front of emergency response and preventing emergencies. So thank you. I think that this was outstanding, the presentation. And I look forward to the relationship to continue and to flourish. I would offer an opportunity if there are any questions the committee may have. Councillor Murphy, please.
Thank you, Chair. Thanks, Andy. That was very interesting. Just one question. On one of your slides, you show a mobile intensive care unit that it said it was staffed by an ACP, a nurse practitioner. Is that full-time, like a sort of a hospital on wheels, if you will?
Yeah, it's like a hospital on wheel, and we have also a specialized doctor on it. So there's the crew is 3 members. And we can do everything what an intensive care unit can do. And then most of the time we transport from local hospitals, really critical patients, to a bigger hospital like in Ottawa. And that's a really, so they have not as much calls, maybe 2 or 3 on a day, but this calls, we need this car, and it's really necessary to have that in Bavaria. And we have 6 of these cars in whole Bavaria, and one of it is in Regensburg, who cover an area from around about 4 hours from where we are.
Thank you for that. I wish you hadn't put that in Mike Nolan's head, but okay. No, it's very interesting, and I think it would serve our community very well. Of course, Mike's nodding at me, but very interesting when we're seeing a lot of states or counties in states that are doing crisis teams that are basically a mobile intensive care surgical unit. It's very interesting. Thank you.
Thank you for the question.
Thank you. Anything further? Councillor Lafreniere, please, on the video.
Hi. Thank you, Andy. Very inspiring, and it's wonderful to see the collaboration that has come out of this friendship. My question is, on one of the slides, you had listed experienced volunteer groups. Can you elaborate a little bit on that? What types of roles do they play, and what type of experience do they need?
So the disaster management in Germany is based on a volunteer units. So on one side we have specialized volunteer firefighters who run all the firefighter stuff, and the Red Cross has the responsibility to take care of the citizen. So we had 3 years ago a big flooding in, I don't know, you hear it in Ahrntal. So a very big region was completely flooded. We have over 100 people died there. So we sent Germany-wide the THW, and from my service the communication unit to go there to the Ahrntal and build it up, everything again. As well, we sent the marine service there because all the area was flooded, so we need specialized marine paramedics who go on scene by boats and treat the patients or rescue the patients. And it works very well, but it's like everywhere, it's hard to find people who spend their free time to be a volunteer. And you need a lot of education. So for mine, I'm a water rescue paramedic, and I spent 9 weekends of education in my free time to go to the status. And you have to you have to maintain your license to do training every year. So it's a lot of work, but I'm proud to serve in my free time for my citizens in my area, and that's how it works.
Well, I want to commend you for thinking outside the box in your community as well, and welcome and enjoy the rest of your stay. Thank you.
Thank you very much.
Chief, I think you wanted to comment.
Yeah, thank you. And Andy raises a really important point around how do we integrate best with volunteers. And I know a number in these chambers and their municipalities have had some flooding this year. Councillor Nicholson, I know, had many sleepless nights as a result. But, you know, it is remembering back to actually February of 2018 when we invited the THW, which was the German civil defense group, to come and do the training. So any of your municipalities that use ladders and pylons as part of their sandbag filling exercise learned that from Andy's peers from the THW. So we had asked them to come in, and they trained over 40 municipal staff, local municipal staff, in flood mitigation efforts based upon the THW's process of flood mitigation and volunteer management. And at that time, you may recall that there was some discussion, for those of you that were in the chambers at the time, that Canada, and specifically Ontario, do not have volunteer civil defense. Most other Commonwealth countries, and Germany's a great example, where taking from the days of conscription and providing an opportunity for people to become civil defense experts and volunteers is an exceptionally good way of allowing your municipalities to not have to put your fire departments to the task, or taking this notion of trained volunteers, which many don't have, right? It show up, here's a shovel, thanks for coming out, here's a muffin. The reality is that you're on the hook for their WSIB responsibilities and so on and so on. So we've said many times that the THW and what Andy's presented to us is a model of excellence that Canada needs to engage in from a civil defense perspective. Most other countries have volunteers who are trained for specific tasks. Flood mitigation is an example. Often heavy urban search and rescue, even search and rescue are tasks that the THW undertakes. They have canine units. So you can imagine people that live in your communities, and maybe they're a retired engineer, right? Maybe they're a retired school teacher who has a particular aptitude towards volunteerism. This is a way of actually standing up a team and maintaining the knowledge, skills, and ability of that team at no cost to the municipality, because it is a federally funded program in most other parts of the world. So just something to consider, and just worth refreshing, because it was the German embassy, I believe Warden Emo will remember, that it was the European Union embassy actually invited us to an event to encourage Canada to establish a civil defense force and we encouraged Ontario at the time to undertake similar efforts so as to not put all the burden on the local municipalities to establish, maintain, train, and then cover all of the costs associated with those volunteers. Thank you.
Thank you for that, Chief, and I do recall that time, and from that time, I think that is a superior approach to emergency management than the one that we employ right now. I think it is most acute for Councillor Nicholson in the red that is just ended a state of emergency in his municipality from flooding on the Ottawa River, and it is the challenge. We all have very diligent and capable individuals, and God love the volunteers that are stepping forward for our emergency groups. But one of the conundrums of an emergency is oftentimes you're responding to an emergency in your community and you were already affected by that emergency. So it seems counterintuitive, and to that plan, I often think of Mike Tyson's notion of everyone has a plan until they get punched in the nose, and likewise, everyone may have a plan until the tornado comes through. And then those who were supposed to be part of your volunteer group may have had their homes damaged, destroyed, etc. So I think that it is a substantially superior approach to emergency. So I think that might be a component moving forward, Andy, that we will continue to explore. I think there is ample opportunity for you to show us perhaps the best path forward. Anything further? Warden Emo.
Thank you very much. As Chief Nolan noted, my interest started with an invitation to the embassy and meeting for the first time the ambassador and some representatives who talked about the importance of disaster readiness, and then also the importance of exchange of ideas and practices. And I think this demonstrates best practices and quality and safe response knows no boundaries, and it's a mutual highway that travels both ways. So information is freely exchanged, and best practices are best exchanged by frontline staff with support from those of us in policy making. And I would ask, the question I'm getting to is could you explain the relationship between the Bavarian government and your federal government and Germany, and just how that is there an overriding act that trickles down? And I know that the relationship is not similar to our federation. So if you could just give us a real quick lesson on governance.
That's challenging me, but I try. So the responsibility for the disaster management is at the federal government. And they put it down to the states and said, okay, I would like to have these, so just do it for me. So all the volunteers units are founded by the federal government, Federal Republic of Germany. And yeah, I'm not really specialized in that part. So I'm not good prepared to explain, so I'm sorry.
No, that's fine, thank you. No, it's just...
So they're working all close together, that's the main message, and there's no gap between it's your fire, it's my fire, and it's my money, it's your money. So disaster management is all over Germany. And for example, Ahrtal, who was the big flooding, is 600 kilometers away from my town. And there was no discussion about is the Red Cross Regensburg prepared to send there some special units. We did it. They came from all over Germany because in this big disaster, all work together, and that's the main message. There's no, again, it's your fire, it's my fire. No, it's the problem all over Germany.
No, and thank you. That's perfect because that demonstrates the fractured approach that we have to emergencies in Canada. So thank you for that.
Thank you.
Chief Nolan.
Thank you, and I think just to underscore, if I could through you, Mr. Chair, and I saw Councillor had her hand up over here as well, so my apologies. If you prefer she go first, I'd be happy to follow.
I think that I will do that, yeah. Please, Councillor Yan.
a very good idea. I can see where that could be a benefit to us in Renfrew County. And I'm thinking that if the Ontario government has an interest in offering a program like that, and we would have the human resources and that to, perhaps we could be a pilot project.
I think that I would be quite interested in working towards empowering and putting in place this, but I think it was a pretty substantial undertaking to transform what I think that is a not high efficiency response or a highly efficient response to emergencies in this country. But I like the way that you think, Councillor Yon, for sure. Chief.
Thank you, Mr. Chair. And similar to Councillor Murphy's comment earlier, I'm not going to take the bait quite yet, but I'm happy to try new things and bring back maybe a little bit more structure to some concepts that Andy has provided to us in chambers, but also in the hours and hours of conversation that we have. For every one idea that Andy takes from Renfrew County, I think we steal two from him, and we're proud to do that because it truly is a partnership and a relationship and something that has gone back and forth for many years. I would also underscore that some of you may remember the CBC National story that we had done during the pandemic, and there was a WhatsApp group of international contributors because, of course, Germany, Spain, Italy locked down before we did here in Canada, and Andy is one of the faces from that WhatsApp group to share those early COVID experiences and to give us the intel in terms of what is the social response, what is the medical response, what is the political messaging, so that we were able to provide that and feed that back into you here in these chambers and virtually through the EOC over that time period. So there are many sort of quiet benefits to that process. The other, at a more local level, as a good reminder, and as I'm sure Councillor Nicholson now knows, that really the municipality that has the greatest effect from flooding or a tornado or a major wind event is often the least capable of being able to manage complex situations because it affects the families of the people that you're now asking to respond to others, and it affects that social fabric within the community in a way that it's hard to comprehend. So it's no surprise to me that Andy says 600 kilometers away, no problem, we're there. And in fact, in major disasters, the further away you are from the disaster, the more capable you are of being able to provide not necessarily the initial response, but the legacy of the response, and then also to be able to support the recovery effort. So the THW, as an example, but similarly with the Red Cross and the paramedic service units that responded across that jurisdiction, they come rested, they come ready, right? They're not the ones having to worry about their families in those moments. They're the ones who can focus on other people's families. And I think that really does speak to that national model and that national lens of how do we have prepared units across the country for the country. Right, the Ringsburg unit is the least capable of taking care of Ringsburg in those moments, right? They may take care of the first hours until help arrives, and then it's their opportunity to then coordinate the response and welcome that. And I'd go back to 2019 when we had the military in Whitewater region and others. That was very overwhelming for the local community, and they welcomed help from all of the municipalities in Renfrew County. And it was only 1 year before that flood that the German THW was here sharing those lessons with your municipalities at the time. So some good reminders. I think there are some great opportunities, but this year's flooding, the pandemic that we've all lived through, are good reminders in terms of how we can share and learn from others. And I couldn't be more proud of Andy standing here before you today, sharing these lessons learned and representing the other 3 paramedics that came last week. And a big thank you to all the paramedics, the 911 paramedics, the community paramedics, and our special units for sharing those lessons because they were working in ambulances shoulder to shoulder with our paramedics, dealt with some very complex medical calls over the last week with us. So big thank you to him, and look forward to continue our working relationship.
Thank you very much, Chief. And once again, Andreas Bauer, thank you so much. Very pleased to have hosted you. With that, Mr. Blackmore, we will go directly into the long-term care report. The floor is yours, please.
Thank you, Chair Donahue. Through you to committee. The first two items in the long-term care report, they speak to vacancies for each of the county homes for the periods February to April 23. And you'll note that both homes are not maintaining above the 97% threshold that's required to maintain 100% of funding. And also to note, you'll see at Miramichi Lodge that we have some admissions to our respite program that's been restarted. The respite program at the Manor remains on pause at the present time with regard to some staffing challenges that are ongoing. Item number 3 gives an account of the wait list for Renfrew County long-term care homes. There are 604 applicants awaiting placement and 235 applicants that are, residents residing in another home seeking to transfer to their first choice. So essentially that translates into a total of 839 residents awaiting to go to their first choice of placement, with 398 of those indicating county homes as their first choice. Item number 4 is the March 2023 variance report for each home, starting with Monashire Manor on page 8 of your report. And as you'll note, several budget lines continue to show a significant variance in overages, and this is largely related to COVID expenditures. Committee will recall that COVID-related funding ceased effective March 31, and that we are expecting our final tranche to offset these overages. By way of example, you can see that in the lines for general administrative salaries and benefits on page 10 at the Manor and page 18 for the Lodge show some significant overages, and those account for the screener positions that were required for entrance into the home. And again, those costs will be recovered. Item number 5 is just an update on the Accreditation Canada survey dates. So committee will recall that the governance team, representatives Ward Nemong, Health Committee Chair Donahue, CEO Kelly, Monashire Manor Administrator Dean Quaid, and myself will be meeting with Surveyor Ruth Chalmers on June 27th. And I'll add, I'll just bring this to your attention now, Warden and Chair, that they requested a change in locale from the Manor to Miramichi Lodge, and I recognize it may be somewhat of an issue, and if it is, we could arrange a Zoom meeting. But anyway, if that's okay, I'll indicate as much to them, but if not, I'll seek a change. Item number 6 outlines a two-stage approach in addition to strategies that we've already undertaken to solve current recruitment challenges at the Monashire Manor, and resulting in us having to rely on agency staff to fill our vacant shifts. So we've tried a number of different things over the years. Both homes have had living classrooms. We both actively engage in preceptorship and clinical placements through Algonquin College. We've taken advantage of every provincial fund that's out there, and yet it's time to seek some alternative strategies, because clearly we need something more, particularly at the Manor. So the first stage approach seeks to realize some more immediate results by way of a signing and retention bonuses. So Human Resources Manager Greg Belmore is currently in the process of working on a policy for consideration, and we're vetting that through our legal at the moment, with the hopes of presenting something to Finance and Admin Committee either tomorrow, or we may need some additional timing to put it into our June meeting. The second part of that stage is to actively recruit international talent over a period of several months, where it's our intent to take advantage of the Safe Start funds that are afforded to us for COVID mitigation, to put toward recruiting international staff. We're focusing on PSWs at present, with hopes of recruiting as many as 20. And then the resolution that follows gets into a little more detail where that's concerned.
They certainly are connected, Mr. Blackmore, but I think as typically I will review with committee each of the information items, and then we will get into the resolutions following. So returning once again to page 2 of your report, committee, any questions, comments on the Manor resident statistics? Anything on the Lodge resident statistics? Pleased actually now that the respite beds are being made available once again. Just one more sign of perhaps fully emerging from COVID. Item 3, the home and community care waitlist information. Councillor Nicholson.
Yeah, thank you, Chair. I just wanted to clarify, of the patients waiting, are those Renfrew County patients? Are they able to include patients from anywhere in Ontario that are looking for to be on those wait lists?
That's your Chair, Councillor Nicholson. Yeah, those are Renfrew County.
Councillor Nicholson, follow
up. So the 604 is an example. A large portion of those, because they're on a wait list, would they be supported by our community paramedic program?
Through you, Chair, I'm hazarding a guess because essentially where the long-term care homes come into play with regard to placement is we get the application, we basically say yes or no. We're not the gatekeepers, as it were. So aside from asking Chief Nolan, I would hazard a guess that some of them are. The exact number, I'm not sure.
I think that's a safe assumption. Of course, the wait list, you see what it is here, home and community care. It used to be the CCAC is the agency tasked with the eligibility for long-term care, that it is outside of the home's purview, any of the homes listed here, whether they are the County of Renfrew homes or others. But perhaps Chief Nolan might be able to. Certainly, one of the branches of community paramedicine is the community paramedics in long-term care. So perhaps, Chief, the question from Councillor Nicholson, where there were 604 waiting for entry into long-term care from community hospital, and the question was, would all of those be eligible or be receiving support from the CPLTC?
Yeah, thank you, Mr. Chair, and my apologies for being out of the room. The role of the community paramedic and long-term care model is about managing those on the wait list, those who are eligible to be on the wait list, meaning they have a MAPLE score as evaluated by home and community care, but have not yet chosen to be on the wait list, and then those who we see as on a trajectory for long-term care. So new onset of a disease perhaps, but not yet evaluated with a MAPLE score for eligibility into long-term care. So we currently manage over 800 persons in Renfrew County through the community paramedic and long-term care funding. So the direct answer is the vast majority of those on the wait list for long-term care are currently receiving care from community paramedics. All of those on the wait list for long-term care are eligible to receive care by our community paramedics in support of staying at home. And one of the dynamics that we've seen is that by community paramedics as a team-based approach, interprofessional approach to supporting those on the wait list for long-term care, we've now seen people defer their placement into long-term care, provided they're able to receive the support of home and community care and community paramedics to stay home more safely. That allows more appropriate people to get crisis placement into long-term care and to take as many people off of the crisis placement list as possible by stabilizing their care in the community. Another important component of that is VTAC, because many people eligible for long-term care do not have a family doctor. That's an important component, that the community paramedics, home and community care, and those individuals now have access to better primary care, which again should help stabilize their acuity or their criticality and diminish the urgency for them to be placed into long-term care in favor of those who have conditions that cannot be managed medically or have risk or prevention measures put in place. So said differently, those who may have significant dementia, for example, right, may or may not be able to be cared for in the community safely, but require the expertise of Mr. Black Blackmore's staff to be able to provide wraparound care in the home in a safer environment than those living in the community.
Follow-up or, okay.
Thank you, Chair. The statistics are interesting, and if we had an opportunity in the future, I'd be curious to, if we had that breakdown of the community care patients by those three categories, even if we could find the geographical significance of some of those numbers, I'd be curious to know more if that's something that the committee would be able to get access to.
Okay, thank you. Any other items on, or questions on item 3? Anything on item 4, the treasurer's report? I had a couple, now I think they're probably both related, Mr. Blackmore. I note in particular substantially underspending within the nursing line. I think that we've established that it is the challenge, the health human resource challenge that every health sector is experiencing. Is that so here? And I'll put the second component on the table too because it might be related. I note that there is a substantial shortfall of revenue. Both homes are made eligible for some significant funding towards the 4 hours of care. And I note in both the manor and on the lodge, and I think for committee that may be on page 7 and 21, you'll note that we actually have not accessed any of those funds to date. I wonder if you could speak to that, Mr. Blackmore.
Certainly, Chair, through your committee. So that the funding that we're receiving from the ministry is based on an incremental increase. You have to demonstrate an increase in hours. And at present, we're more challenged to do so at the manor with regard to some of the recruiting challenges we have. At the lodge, we've been successful in exceeding our baseline in our first stage of hiring to the point where near all our vacancies are filled. And now we're approaching our second stage of recruitment for the Miramichi Lodge. Thus far, we've been fairly successful in filling those positions at the lodge. Again, the challenge remains at the manor.
Okay, thank you. So we certainly are still experiencing, we still are in that regime of having to fill shifts, et cetera. Thank you. Any other items on the Treasurer's report? Item 5, Accreditation Canada survey dates. And item 6, the manor staffing and the enhanced strategy. Councillor Murphy, please.
Thank you, Chair. I think this is an amazing initiative. Just one question about international students. I have no doubt that their skills are transferable to Ontario very easily, but would there be, for lack of a better term, accreditation that they would need to get? Where, you know, I think about mechanics. A mechanic in Ontario has to be relicensed to work in Alberta. And so I'm just wondering if we recruit, you know, even 10 internationally, what is the onus on them when they get to Canada? Thank you.
Credentialing, I guess, Mr. Blackmore.
Through Chair to Mayor Murphy. So that's part of the fees we paid to the consultants. Essentially, that's part of the fee schedule is validation of credentials.
Follow-up, Councillor Murphy?
And I see that in number 7 with the consultants, but are we assured that they can work here if the skill is transferable? Like, I would hate to see us utilize some of these monies, you know, the foreign worker fund, and find out that no, they have to do, you know, a year of retraining to work in Ontario. Thank you.
Mr. Blackmore, please.
Through you, Chair to Mayor Murphy. Again, that's within our contract with the provider is that the credentials of the individuals coming over satisfy the Fixing Long-Term Care Act.
Okay, thank you. Any further questions on item 6? Councillor Nicholson, please.
Thank you. Question just on the, I really applaud you for the approach in terms of recruitment, trying to solve the problem. You've exercised every other option leading up to this, and I think it's good for us to continue to try new things. The first question is just the international recruitment or foreign workers. Does it include wraparound supports? Like, I would, if we can get new people to come to this area, they want to settle and fill these important vacancies that we have in healthcare. How do we make sure that they want to stay here if that opportunity still presents themselves? And I know the contracted services are going to, provide the funding and get them over here and check the boxes that Councillor Murphy was speaking to. But what about all the other wraparound supports to make sure they're welcome in the community and they see this as a potentially a long-term decision? I want to make sure those are included in that process. Has that been considered?
Mr. Blackmore, please.
Through you, Chair, to committee and Councillor Nicholson. Yeah, that's at this point, the putting together the contract, getting the offer out there was our first kind of swipe. But yes, we've had those discussions, and we haven't arrived at, definitive strategies at this point, but we are giving consideration to what are these other things that we can do with regard to support, whether that be housing or creating like common communities, assuming that maybe a group come over together. Is there an opportunity to link them up with spitballing that we may have some staff that already work from a particular nation that may be able to be a bit of a mentor, or anyway, exploring those avenues. We're very much in that stage of the process right now, recognizing that this particular process to come to fruition, we're likely looking at, we have a little bit of time, probably into early 2024.
Would it be fair to say, Mr. Blackmore, that the issues raised by Councillor Nicholson, they have been anticipated and they are whiteboarded at this point, but there is no definitive answer to the question currently? Correct. Is that accurate?
That's it. Yes.
Okay. Mr. Kelly, you wish to add something?
Thank you, Chair, and through you to committee. Is an ongoing conversation, again, thank you to Mr. Blackmore for bringing this up, is our efforts with both the OHT going forward and with economic development through Mr. Davis's department with the local immigration partnership group. I think that's an important relationship to maintain, especially with this in mind. So we'll rope them in. We'll bring them into the our tent. We'll rope them into helping us out. They're always looking for different initiatives to assist with, and we've been an active partner with them. I'll note the province yesterday, the day before, launched the Learn and Play grant for 3 programs, at least paramedics, medical labs, and practical nursing. Now, there's another avenue, at least for nurses. Should they study at Algonquin College locally, they are required then to, if they take advantage of this grant, to have a return for service. So I think a lot of work would be done with the LIP, the Local Immigration Partnership, in the future, and I think they'll play in well together.
Thank you, Mr. Kelly. Follow-up, Councillor Nicholson.
Thank you, Chair, and that's excellent. I'm very happy to hear that it's all considered. I'd also encourage that if there's an opportunity for us to, if we put in the contract out for 10 foreign workers, if there are other partners in the community that would like to jump onto that contract opportunity, we could get 25 of them in, and with that concentration, maybe satisfy some needs across and use the partnerships that we've created or are in the process of creating to provide that wraparound support. I would even consider partnering with City of Pembroke, City of Renfrew, the concentrations of where these employees are going to live and play. I think those community leaders would also play a big part in welcoming and ensuring that they want to stay in and fill these jobs. So I see a lot of potential. I applaud you for the initiative, and I would encourage that we continue to put some weight behind it. Thank you, Chair.
Thank you, Councillor Nicholson. Councillor Murphy, please.
Thank you, Chair. I was going to wait till number 7 to ask this question, but I might as well do it now. Do we have a sense from these consultants, knowing that there was COVID burnout all around the world, it wasn't just in Ontario or in Canada, do they have a sense of how successful international recruiting can be specifically for a PSW position? It just seems like we've seen the loss of healthcare workers around the globe. So I'm just wondering, are we trying to recruit from places that didn't see the amount of burnout that we saw?
Mr. Blackmore, please.
Through you, Chair, to Mayor Murphy, I can't really speak to the degree for which, you know, the personnel coming from other countries experienced. I would imagine it would be similar to that which we did, but it's my understanding that at present time, recruitment is successful. We're seeing other agencies hire people. I believe Carrefour right now is in the midst of doing something similar. Marion Hill's got something in line as well, where they're going to see their first staff come on board. So I would expect you're going to start to see a lot more agencies and healthcare providers seeking the same path, and maybe that at some point limits availability. I'm hoping that we're not too late to the game.
Thank you, Mr. Blackmore. Anything further on item 6? Okay, the floor is once again yours, Mr. Blackmore.
So into resolutions. Item number 7 is a resolution seeking to enter into an agreement to secure the services necessary to effect recruitment of up to 20 PSWs via the Foreign Temporary Workers Program. So, shall I read the recommendation?
Please.
Recommendation that the Health Committee recommend to County Council that the Warden and Chief Administrative Officer Clerk enter into an agreement with Contact Staffing Solutions to coordinate recruitment of up to 20 international personal support worker staff at an average per candidate cost of $7,800, subject to variance in airfare charges, equating to an approximate cost of $156,000 through the Temporary Foreign Worker Program. Fees include completion of labor market impact assessment application per Employment and Social Development Canada.
Thank you, Mr. Blackmore. Could I have a mover, please? Councillor Nicholson, seconded by Councillor Weir. Background, Mr. Blackmore.
Thank you, Chair Donahue. If you'd bear with me, I'm going to just read from the background as not to miss anything here. As identified to committee, the traditional recruitment measures failed to close the gap where recruitment for nursing staff at Bonacher Manor is concerned. Like many long-term care homes across the province, the manor has become increasingly reliant upon staffing agencies to fill vacant shifts. With costs inclusive of mileage, accommodations, and agency fees, and hourly wages comparable to county staff overtime rates, we will soon deplete what is left of the COVID-19 Safe Start Agreement funds. Many healthcare institutions, including long-term care homes, are seeking to fill vacancies with healthcare providers from abroad. Such an endeavor aligns appropriately with County of Renfrew's strategic plan, in particular goal number 2, workforce development. Within the county, the advent of additional long-term care beds coming online, coupled with all homes competing to achieve mandated hours of direct care, one can expect to find an increasingly depleted pool of available recruit candidates. Bracing for this inevitability, expanding our search radius to include international staff seems a reasonable option to add to recruiting strategies for the County of Renfrew long-term care homes. Sorry. 3 foreign worker recruitment agencies were consulted concerning services and associated fees. Upon consideration, staff recommend proceeding with Contact Staffing Solutions, have it presented with the lowest associated fees for comparable services. Award of the contract is consistent with County of Renfrew GA01 procurement of goods and services policy.
Thank you, Mr. Blackmore. Any questions, comments? Seeing none, all in favor? That is carried. Thank you. Moving on to 8, please, Mr. Blackmore.
Item number 8 is a recommendation concerning a delegation request to the AMO conference. Recommendation that the Health Committee recommend that County Council approve the submission of a delegation request for the 2023 Association of Municipalities of Ontario Conference with the Minister of Long-Term Care to address the County of Renfrew concerns with the current model of case mix index funding, and further that the Finance and Administration Committee be so informed.
Thank you. Could I have a mover, please? Councillor Grills, seconded by Councillor Lafreniere. Any background, please, Mr. Blackmore?
Thank you, Chair Donahue. Again, I'll read from the background. The background is that case mix index funding is a challenging process, as the reindexing factor for the year can result in long-term care homes losing funding despite the increase in acuity, as is generally the case across the entire long-term care sector. The opportunity will be taken to reinforce and support of sector peers that the methodology is fraught with disadvantages, including the reliance on year-old data to determine what portion of the funding any home will receive for care irrespective of current acuity levels. Significant levels of precious registered staff required to complete each resident assessment is a resource that would otherwise be dedicated to frontline care delivery. Data accuracy in the absence of data quality audits, as well as the relative lack of non-medical based indicators, are among the concerns to be raised.
Thank you, Mr. Blackmore. I think, curiously, these conditions are both chronic and acute. We've been talking about them certainly from the time that I've been sitting in this room. So I think this is certainly worthy of having a discussion with the minister. Any questions, comments? Councillor Murphy.
I don't want to say that this is the definition of insanity, but it is the definition of insanity. Going to the Ministry of Long-Term Care, once again, I can't think in the amount of years I've sat in this chamber, how many times we've tried to explain CMI does not work, and yet they continue to use CMI. So I applaud all of you that are going into this delegation. I hope we get it, and I hope the minister listens, because something's got to give with this CMI. Thank you.
We shall be the irresistible force confronting the immovable object. Councillor Nicholson, and then I will come to the warden.
Thank you, Chair. Just a question from a newbie. Is there any advantage for us to be doing joint delegations with other counties who are probably making the same argument or making a recommendation to the Warden's Caucus to also do the same thing? Has that already been done before?
Actually, the warden may be very well placed to answer that.
Thank you. We did have a delegation in January at Roma. We're headed back at AMO as well, and the contention is that it's a barely understood process, and what good is it? You know, because we're spending a lot of time sending in information. What is the information used for? Because you don't see it coming back, and is it very necessary? And you know, the overriding message in small print is it's not an effective measure, and it's a waste of time. So we'll be, you know, the 13 members of the Warden's Caucus have been there as the caucus. They've shared it with the Western Warden's Caucus. They're supportive of the language as well, and I will be attending their delegations, and we'll try and slip it in if they don't. So yeah, we are pushing back on it. I know FONAM and NOMA have the same. In northwestern Ontario and in north central Ontario have the same concerns. The ministry, I think, may not know what to do differently because it's been there so long, and may not want to strike a task force to change it. So I think we just have to keep applying pressure. I'm a believer in if you throw enough water on a rock, the rock changes. So we just keep throwing water on it. So.
CMI, what is it good for? Absolutely nothing. We'll say it again. One of the things that is worth, certainly, Councillor Nicholson, what you had supposed, there is a value in that. There is also, though, a value in having numerous delegations that are delegating the same message as opposed to consolidating. Councillor Murphy.
Thank you, Chair. And just further to the Warden's comments, when I sat on the caucus, we talked about this, and one of the challenges was that some long-term care home CMI was quite high, and they didn't want to rock the boat. It's only when your CMI, you think it's going to be here and it's here, that's when you want to rock the boat. But when you've got somebody, a long-term care home, say in Prince Edward County, and you know they expected 95 and they got 98, well, they're not going to do a delegation, nor do they want to be a part of one. And I'm just using PAC as an example. I don't know what their CMIs are, so.
So once you take those pieces of gold, you see. Warden, the next question was yours. I apologize for missing you.
No, my comment was about CMI. Thanks.
Okay, thank you. Anything further on the delegation resolution? Seeing none, all in favor? That is carried. Mr. Blackmore, on to item 9, please.
Thank you, Chair. Through to committee, item number 9 is a resolution for the replacement of the Bonnechere Manor portable phone system. A recommendation that the Health Committee recommend that County Council award Bonnechere Manor portable phone replacement request for proposal BM 2023-01.1 to Simtel, Ottawa, Ontario, as per County of Renfrew GAO Procurement of Goods and Services Policy, Section 20.7, for a total price of $198,963.62, inclusive of HST, with $180,000 approved in Bonnechere Manor 2023 capital budget. And further that the committee recommend the County Council approve the reallocation of $9,000 in surplus capital budget from the roofing project, along with a reduction in scope of the $30,000 sprinkler capital project by $9,963.62 to fully cover the cost difference. And further that the Finance and Administration Committee be so advised.
Thank you once again, Mr. Blackmore. Mover, please. Councillor Yon, seconded by Councillor Wilmer. Any questions? Actually, the background, please, Mr. Blackmore.
As background, approved through the 2023 capital budget was the Bonnechere Manor portable phone replacement request for proposal at a cost of $180,000. The portable phones are linked to the OSCO nurse call system with the ability to make and receive calls from other users, as well as receive signals for service from the nurse call system, indicating a location of call for service. Portable communication devices are assigned to each resident home area. The new system will be capable of operating at a minimum of 60 devices with the ability for expansion if needed. Simtel, the current company that supports the maintenance of Bonnechere Manor portable phones, was the only company that provided a bid. Simtel provides 2 options. Option 1 is the basic system and will support our needs at a cost of $147,808.57, which falls within the approved capital. Option 2 allows for greater flexibility for future upgrades and replacements of our nurse call system, as well as eliminates the need for an annual service maintenance agreement, resulting in an annual savings of approximately $2,300. The complete cost for option 2 is $198,963.62. Staff is proposing the approval of option 2, finding the cost difference with your allocation of $9,000 in surplus capital from the roofing project, along with reducing the scope of the $30,000 sprinkler capital project by $9,963.62 to cover the approved budget overage. A recent consult concerning current sprinkler system conditions supports the reallocation of these funds.
Thank you, Mr. Blackmore. Open to questions, comments. Councillor Frenier, please.
Thank you, Mike. Just a question. So the system we're using now, is it outdated or just not filling our needs? Just if you could answer that question. And then I wanted to know the system we're using now, so it's not compatible. Would we be able to use it as a backup, or maybe just a little history on it?
Mr. Blackmore, please.
Thank you, Chair. Through to Councillor Frenier. Yeah, it's a matter of compatibility and system, well, a durability at this point. And they're not, once we introduce one, we can't go back to the other. It's
okay.
It's time for replacement.
Thank you very much.
Any further questions or comments? I had a couple, both of them process related, Mr. Blackmore. As it was not a sole source tender, but it turns out to have been a sole source response. Given that, have we done investigations? Are we satisfied that this is a competitive bid? The second component was, in the distinction, certainly the $2,300 a year savings would alleviate the delta between option A and option B, but there is substantial value, presumably, to the higher option that is bringing sufficient value to warrant that additional expenditure. Those are the 2 process questions.
Thank you, Chair Donahue. So the second, in answer to the second question, the value that the new system brings with regard to expandability is the primary reason for the choice. And with regard to the selection of the vendor, it's in accordance to the policy, and we're satisfied. We're familiar with the vendor.
Okay, thank you. If there's nothing further, I'll call the question. All in favor? That is carried. Thank you. Back to you once again for item 10.
Thank you, Chair. Through to committee, item number 10 is a resolution seeking to reallocate surplus capital budget funds to cover an unanticipated replacement of the Manor's 100-pound laundry washer. A recommendation that the Health Committee recommend the County Council approve the reallocation of $14,177.35 from surplus capital budget from the roofing project to fund the purchase of a 100-pound commercial laundry washer from Dalex Commercial Laundry Systems, Concord, Ontario, and further that the Finance and Administration Committee be so advised.
Thank you. Let's seek a mover, please. Councillor Weir, seconded by Councillor Murphy. Background, Mr. Blackmore.
Thank you, Chair. Through the committee, as background, approved through the 2023 capital budget for Bonner Manor was the supply and installation of a 100-pound commercial washer request for quotation at a cost of $30,000. As per County of Renfrew GA01 Procurement of Goods and Services Policy Section 9.2, 2 written quotes were received and staff are requesting that the lowest quotation price of $44,177.35 from Dalex Commercial Laundry Systems, Concord, Ontario be approved, with committee and council approving the unbudgeted amount from the reallocation of the unused capital budget from the roof request for tender.
Thank you very much. That roofing project is certainly paying dividends in 2 different areas. Any questions or comments, Council? Councillor Nicholson.
Just a question on that. When an asset like a commercial washer is replaced like this, the old washer, I'm assuming it's sold for scrap. Is there some revenue recognized for that sale? In some case, maybe this is outside of long-term care, but...
I'm going to presume, I don't know if this needs to be declared surplus, as some items would. I would think that there's very little residual value. Mr. Kelly, do you know the process?
To you, Chair, if it's garbage and scrapped, so it's declared surplus. Normally, if it's in working order and can be reused by some other manner, not capital M manner, but manner ER with 2 N's. But no, if it's I understand it's not working or otherwise, it would have just been sold off as scrap or disposed of appropriately.
Okay, thank you. Is that satisfactory, Councillor Nicholson? Thank you. Anything further? Seeing not, all in favor? Carried. Item 11, please.
Thank you, Chair Donahue. Item number 11 is a business case for Administrative Assistant 3. So it's a business case seeking consideration for the redistribution of the Health Committee duties from the Community Services Administrative Assistant to the Long-Term Care Homes Administrative Assistant 2 and Emergency Services Administrative Assistant 2, which was the practice prior to August 2021. A recommendation that the Health Committee recommend to the Finance and Administration Committee to recommend that County Council approve that the Health Committee administrative duties be returned to the Long-Term Care and Emergency Services Administrative Assistants consistent with the duties assigned prior to August 2021, and further that the Long-Term Care Homes and Emergency Services Administrative Assistant 2 positions be reclassified to Administrative Assistant 3 positions consistent with the Gallagher Report findings and Employment Bylaw number 1, non-union staff salary grid.
Thank you. Once again, I would seek a mover. Councillor Wilmer, seconded by Councillor Grills. Background, please.
Thank you, Chair Donahue. To committee, background from 2004 to 2021, there were 3 administrative assistants sharing Health Committee administrative duties, 1 for each of the 2 long-term care homes and 1 from emergency services. In June 2021, the responsibilities of the Health Committee administrative duties were transferred to the Community Services Administrative Assistant, assuming committee duties along with the Renfrew County Housing Corporation and Community Services Committee duties to ensure consistency of reporting. Following this, the Gallagher Report provided an assessment of position duties, and based upon the current job duties, it was determined that the 2 administrative assistants previously responsible for minute-taking duties for Health Committee would be classified as Administrative Assistant 2 positions, while the Administrative Assistants with minute-taking duties would be reclassified to Administrative Assistant 3 positions. In support of greater ability to optimize workflow, focus departmental and community support, staff recommend that the responsibilities of Health Committee, i.e. minute-taking and report assembly duties, return to a shared model utilizing Long-Term Care and Emergency Services Administrative Assistants 3 as per the business case attached as Appendix Long-Term Care 2.
Thank you, Mr. Blackmore. Questions, comments? Seeing none, all in favor? That is carried. I believe that is the end of the long-term care report. Could I have a motion, please, to accept the long-term care report? Moved by Councillor Wilmer, seconded by Councillor Yon. One further and final opportunity for question on anything contained therein. Seeing none, all in favor? That is carried. Thank you. We are just about to embark. We've been 75 minutes. Does anyone need a 5-minute sojourn? We will recess for 5 minutes. If you could provide the countdown, please, Ms. Welcome back, everyone. That is a Renfrew County 5-minute break. With that, Chief Nolan, I will yield the floor for the Emergency Services Report, please.
Thank you, Mr. Chair. Through you to members of committee. Item number 1, I think, was very well overviewed by Mr. Andreas Bauer, and did an exceptional job of explaining our relationship. And he welcomes any members of committee and council that are interested in the Bavarian system to please reach out, and he'd be happy to facilitate a response or welcome you to his service and his community for a more in-depth look as well. The second component related to item number 1, Mr. Chair, is some training that we provided on palliative approach to care on April 13th at the Horton Community Center. Thank you to Horton for allowing us that space. And this was a interprofessional training day hosted by the paramedic service, but also included several nursing providers and home and community care providers as part of the palliative circle of care that we participate in. Item number 2 is attached as Appendix ES1. And that's a letter from the Assistant Deputy Minister and Chief of Emergency Management, Treasury Board Secretariat, reporting to the County of Renfrew that we've met our 2022 Emergency Management and Civil Protection Act requirements. You'll notice in the letter it says that we've met our 2023 requirements, so we're going to hold on to this letter for next year. And they've already issued us, after we notified them that they were off by a bit of a year, that we now have a letter from last year and this year, so the heat is off. The second component related to the spring frechette, and I think we've had some discussion about that previously in the meeting as it relates to the THW and the Red Cross, but the spring frechette, it's going to be an ongoing issue for a number of municipalities who are in recovery. Many of the landowners as well have been significantly affected by this year's flooding. Certainly thank you to all of the municipalities, the volunteers, and those that came to one another's assistance through this spring frechette. Thank you to Steve Ospenko, who, as one of the regional CEMCs for Horton and the acting CEMC for the county, led many of the conversations as well. And that's not to say that we're here to celebrate everyone's efforts, because a number of people have been negatively impacted, but there are people that have dedicated all of their time in the last few weeks and months to the frechette. And we saw many of the learnings that the THW brought us in 2018 used in this year's flooding efforts. So when we look even at the sandbags and the use of the sandbags, high volume pumping and so on, there was a considerable effort, and something that I'd like to remark that we've absolutely learned from the past and leaned into this year's flooding in a way that was more coordinated than we've seen before. I'm sure there are many questions about water regulation and the cadence of information, but the individual municipalities, their councils, and others, I saw firsthand, did an exceptional job at doing their best of providing information and the tools necessary for homeowners to make the best choice on their behalf in terms of flood mitigation efforts. Item number 3, Mr. Chair, related to Paramedic Service Week. The Canadian national theme this year is diversity in paramedicine, the patient, provider, and the profession. And when we look at what that means to us here in Renfrew County, we will be sending out messaging throughout Paramedic Services Week, May 21 to 27. We'll also be hosting a number of breakfast barbecues with our staff to thank them for the incredible work that they've done this year, but also throughout the pandemic, but to highlight the need for an increase in awareness related to diversity and being a welcoming, open, transparent, and kind profession to one another, and as well to the communities that we serve. So a big thank you to the paramedics for all the work that they do, and an opportunity for us to remember them through May 21 to 27. If anybody here would like to be a part of the flipping of food at any of our bases in that week, we would welcome the opportunity for you to come out. So please reach out to my team should any of you be interested in participating. Item number 4, Mr. Chair, the defibrillator program update. The Knights of Columbus Pembroke branch has hosted a free public CPR and defibrillator training session on April 25th, attended by 20 people. And following that training, the Knights of Columbus presented the County of Renfrew defibrillator program with a check for $2,000 to purchase a defibrillator for a location in the city of Pembroke. So a big thank you to the Knights of Columbus for their continued support. As you've seen the Legion and other organizations in the past, this program is alive and well. And we certainly welcome those funds to be able to purchase another defibrillator to make our community safer. Item number 5, Mr. Chair, is the Treasurer's Report for Emergency Services, attached as Appendix ES2. When there's a couple things to highlight within that report, Mr. Chair. One is that there is about 40% of the way down the page, a one-time COVID funding of $124,419.
Just if I could, just 1 second, Chief, committee will find that on page 30.
Thank you, Mr. Chair. Would you like me to pause? Thank you, Mr. Chair. So the Treasurer's Report, I'm just going to give you a couple of the highlights because, of course, the first quarter of this year was, in many respects, the last quarter of what we anticipate as COVID-related funding from the province. And we have received a letter, as you recall, through the budget workshop for $124,419 to offset what would be January, February, and March COVID-related costs for us at the county. But of course, that's the fourth quarter for the province. So as they roll over in March 31st on their fiscal year, we do have that $124,000 to rely upon. So that you'll see as a revenue provincial one-time COVID cost. There is another line within the budget worthy of mention as it relates to legal, and these are labor relations related costs for legal services, dealing with a number of legacy files within the paramedic service. And as of now, we are over budget on our legal related costs, but we are not going into a bargaining year this year. And our hope is to be able to keep these labor relations related costs to a minimum throughout the rest of the year, knowing the pressure that we're already seeing this year, Mr. Chair. Apart from that, salaries, benefits, and our year-to-date actuals are reflecting a number of the pressures that we anticipate as it relates to overtime, end-of-shift overtime, and staffing related issues. We no longer have the pressure of COVID related quarantine, mandatory 10 days as we had previously seen. So we're hopeful that we're able to rely upon that to have greater reliability in terms of our funding pressures going forward in that regard. You will also see, though, that we continue to have pressures related to WSIB costs and our benefit line, and that is also addressed within our resolutions, Mr. Chair, later in the budget, in seeking assistance from the province as it relates to our costs related to WSIB claims within the budget. So maybe I'll leave that there, Mr. Chair. And item number 6 is a resolution.
Yeah, so we'll review as we the format that we did with respect to the long-term care report. We will do the same on emergency services. Back on page 25, the first page of the Emergency Services Reports Committee. Any questions, comments on the community paramedicine program? Item 2, emergency management and/or the spring freshet. Item 3, Paramedic Services Week, May 21st to the 27th. Item 4, the defibrillator program update. I want to echo the Chief's comments, enormous gratitude to the Knights of Columbus for this very generous donation. I think their community and our communities are enormously well served by the defibrillator program, so very thankful for that contribution. Item 5, the Treasurer's Report. Any questions or comments? I just had one, and certainly as everyone in the room knows, there is not a great deal that can be elicited from the first quarter Treasurer's Report. Hardly have established trend lines just yet. Having said that, inordinately pleased, Chief, to see amongst each of the 3 categories the top line in the third column is a parenthetical number in each one of those, and I cannot recall the last time we may actually have seen that. So very welcome news. And of those, particularly where we have seen challenges to cost containment has been within the benefits line. And I note that, again, this is only 3 of 12 months. We were seeing almost a 16% deficit or reduction from anticipated budgeting. So hopefully that is a trend, though it is too soon to say. Anything further on the Treasurer's report? Seeing none, then we will go into resolutions, please, Chief Nolan.
Thank you, Mr. Chair. Item number 6 is a resolution, AMO delegation for emergency services paramedic service. It is a recommendation that the Health Committee recommend and County Council approve the submission of delegation request for the 2023 Association of Municipalities of Ontario conference with the various ministers noted below, which is part of the background, to address the County of Renfrew concerns and further that the Finance Administration Committee be so informed.
Thank you. Could I have a mover, please? Councillor Wilmer, seconded by Warden Emo. Background, please, Chief.
That the 2023 Association of Municipalities of Ontario provide an opportunity to meet with the legislators and ensure the County of Renfrew is heard. Emergency Services would put forward the following discussions. A request to meet with the Minister of Health and or the Premier related to sustainable funding for RCVTAC, for the province to provide funding for all WSIB presumptive claim related costs, moving from 50-50 to 100% funding model. That the Minister of Long-Term Care be met related to sustainable funding for community paramedicine and support the regulatory reform of the Ambulance Act and establishing paramedics in the Regulated Health Professions Act. And lastly, that the Minister of Colleges and Universities address the paramedic shortage in Ontario.
Thank you, Chief Nolan. Any questions, comments, committee? If these all come to pass, I guess I will not be at the plenary session whatsoever at AMO in August. Seeing not, all in favor? That is carried. Thank you. I believe that is the final item, Chief. With that, then I would seek a motion on the Emergency Services report as a whole, please. Councillor Weir, seconded by Councillor Grills. A further and final opportunity for question on any item therein. Seeing none, all in favor? That is carried. Thank you. Returning to the agenda, item 9 is the Board of Health. Item A is the financial statements for the Renfrew County and District Health Unit. I don't know, I'm assuming this is received. Do we need a resolution? I'm assuming we need a resolution to receive, Mr. Kelly.
Yes, Chair, I'd recommend that.
Okay, thank you. So each of these items, but we'll confine it to this one. So with respect to the 2022 audited financial statements for RCDHU, could I seek a motion to receive those statements? Warden Emo, seconded by Councillor Murphy. Discussion. I just wanted to note again, this is consistent with each of the COVID financial statements. You will note, I don't have it open on the particular page, you will note in the breakdown of the allocation of expenditures that once again, some substantial funding for what is termed the mandatory programs or the legacy, if you will, the typical non-epidemic related programs funded through public health. A not insubstantial proportion of that was reallocated to the COVID response once again in 2022. You will see that reflected in the audited financial statements. That is consistent with the statements from each of 20 and 21 as well. Anything further? Seeing nothing, all in favor? Thank you, that is carried. The second item are the Board of Health meeting minutes from the regular Board of Health meeting of February 28th, 2023. Could I have a motion to receive those, please? Councillor Grill, seconded by Councillor Wilmer. Any question or comment on any item of those? Seeing none, all in favor? That is carried. Thank you. Item 10, any new business? Mr. Blackmore.
Sorry, Chair. Yes, if I could, just a bit of news with regard to negotiations with CUPE's locals 3586 and 1805. I can announce that we've reached an agreement in principle to be taken back to the locals for consideration.
That's outstanding news. Very much looking forward to a more comprehensive and extensive report moving forward. So this, as I understand it, then this is in the hands of CUPE to take to their membership?
Correct.
Outstanding. Thank you. Any further new business? I see none. There was no requirement for a closed meeting at the time of mailing. Mr. Kelly, does that remain consistent?
Yes, it does, Chair.
Thank you. The date of the next meeting shall be Wednesday, June 14th, 2023. I would now seek a motion to adjourn, please. Councillor Yon, seconded by Councillor Grills. All in favor? We are adjourned, committee. Thank you.